Hi everyone, welcome back to my YouTube channel and today we are going to talk about nose anatomy. So let's start our topic with introduction. Nose is the most prominent structure of the face and it serves as initial segment of respiratory system. This is responsible for respiration, olfaction, filtration of air, humidification and resonance of voice. Nose is divided into external nose and nasal cavity and parts of nose include external nose and nasal cavity. So talking about external nose, that is the first part of a nose. Its structure includes its framework that is made up of bone and cartilage that is covered by skin. The bony part of external nose framework includes nasal bones, frontal process of maxilla and nasal part of frontal bone. While cartilaginous part of this framework include upper lateral cartilages, lower lateral cartilages that are also called as alar cartilages, minor alar cartilages and septal cartilages. Aperture of external nose is called as nostrils or nares that is opening for air entry. These nostrils are separated by columella that is lower part of nasal septum. Nasal cavity. The nasal cavity is divided into right and left halves by the nasal septum and it extends from nostrils anteriorly to conchae posteriorly. Boundaries of nasal cavities include roof, floor, medial wall or nasal septum, and lateral wall. So, roof of nasal cavity is formed by cribriform plate of ethmoid bone that forms the middle part of the roof. Then there is nasal bones that form the anterior part of roof, and then there is sphenoid body that forms the posterior part of roof. So overall, we can say roof of nasal cavity is formed by three bones. That includes nasal bones that is present anteriorly. Then there is cribriform plate of ethmoid bone that is present at the middle region, and then there is sphenoid body that forms the posterior region of the roof. Next boundary of nasal cavity is floor that is formed by hard palate. And hard palate itself is formed by palatine process of maxilla and horizontal plate of palatine bone. Third boundary of nasal cavity is medial wall or that is also called as nasal septum. This is formed by perpendicular plate of ethmoid bone, vomer bone and septal cartilages. Next boundary of nasal cavity is lateral wall that is formed by maxilla, ethmoid, inferior conchae, palatine bone and sphenoid bone. This lateral wall contains three conchae or turbinates that include superior conchae, middle conchae and inferior conchae. And below each conchae is a meatus that includes superior meatus, middle meatus and inferior meatus. In superior meatus there is opening of posterior ethmoidal sinus. In middle meatus there is opening of maxillary sinus, frontal sinus and anterior ethmoidal sinus. And in inferior meatus there is opening of nasolacrimal duct. Vestibule and olfactory region of nasal cavity. Vestibule is anterior part of nasal cavity that is lined by skin and hair. And olfactory region is the upper part of nasal cavity near the roof that is lined by olfactory epithelium containing olfactory receptor cells. Now let's talk about paranasal sinuses. The nasal cavity communicates with air-filled paranasal sinuses that include frontal sinus, maxillary sinus, ethmoidal air cells, and sphenoidal sinuses. Now let's talk about blood supply of nose. Blood supply of nose include arterial supply and venous drainage. Arterial supply of nose is by internal carotid artery and also by external carotid artery. Internal carotid artery branches that supply the nose include anterior ethmoidal artery and posterior ethmoidal artery that are the branches of ophthalmic artery. Then the blood supply from the external carotid artery branches include sphenopalatine artery, greater palatine artery, superior labial artery and lateral nasal arteries. Rich blood supply forms the Kissel black plexus that is at little areas and it is the common site of epistaxis from the nose. Then there is venous drainage of the nose that nose drain into the facial vein, ophthalmic vein and pterygoid plexus vein. Now let's talk about lymphatic drainage of the nose. Lymphatic drainage anterior nasal cavity is drained into submandibular lymph nodes and posterior nasal cavity drained into retropharyngeal and deep cervical lymph nodes. Nerve supply of nose includes sensory nerve supply and olfactory nerve supply and autonomic nerve supply. Sensory nerve supply of nose is by ophthalmic nerve and maxillary nerve. Ophthalmic nerve supplies the anterior and superior part, while maxillary nerve supply the posterior and inferior part. Ophthalmic nerve and maxillary nerve are both the branches of trigeminal nerve. Then there is olfactory nerve supply of the nose, that is by olfactory nerve, that is cranial nerve number 1, and it is for smell perception at the olfactory region. Then if there is autonomic nerve supply at the nose area, that may be sympathetic nerve supply or parasympathetic nerve supply. Sympathetic nerve supply causes vasoconstriction, and this supply is from the superior cervical ganglion, while parasympathetic nerve supply is the secretomotor gland, and it is through the facial nerve. Now let's talk about functions of nose. First function is respiration, as nose help passage of air for breathing. Second function is olfaction, as in the nose there is smell perception by olfactory receptors. Third function of nose is filtration, as there are hairs that trap particles. Fourth function of nose is humidification and warming, as there is rich vascular supply that warms and moistens inspired air. Fifth function of nose is resonance, as the nose contributes to voice quality, especially the paranasal sinuses. Now let's talk about clinical significance of nose. First is epistaxis, that is nosebleed, that is commonly from the little's area. Second significance is rhinitis, that is inflammation of nasal mucosa. Third significance is deviated nasal septum that can obstruct nasal airflow. Fourth significance is sinusitis, that is infection of paranasal sinuses due to blocked drainage. Fifth significance is fracture of nasal bone, that is common facial injury, and it is mostly by accident or during playing, etc. Now let's talk about conclusion of this lecture video. Nose is a complex structure with roles in respiration, olfaction, and voice resonance. Its rich vascular supply and proximity to paranasal sinuses make it clinically significant for ENT and surgical practices. And this was all about nose anatomy. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.